Medical text, examination of blood in the laboratory, part 2, page 48 and page 49. Hello and welcome to your English lesson. This is part 2 of examination of blood in the laboratory. It's on page 48 and 49. It's about blood smearing, staining, the hematocrit and blood gas analysis. So let's begin reading. On page 48, blood smear. Read the text and try to guess from the context the meanings of the words and phrases. So what are these words? Smear, grease-free, rinse, lint-free towel, spreader, even, thin smear. What is a blood smear? It is a specimen of blood prepared for microscopic examination by smearing it on a slide. A drop of anticoagulated whole blood is spread on a grease-free glass microscope slide in a thin layer so that blood cells can be examined, counted, and characterized. I'm sure you are all aware of this procedure. So we move on to the next paragraph and the title Procedure, Manual Procedure. First, clean the glass slide with alcohol, then rinse it in warm water and wipe clean with a lint-free towel or lens paper. Then place a small drop of blood on the slide and put the end of another slide, in brackets spreader slide, against the first slide at a 45-degree angle. Pull it back against the drop of blood so that the drop spreads between the two slides. Push the spreader slide forward against the first slide. The blood will form an even, thin smear. To dry the slide, wave it in the air. Do not heat the slide. The next step is to cover the blood smear with right stain and allow it to stand 2 minutes. Then add and mix uniformly an equal amount of distilled water or buffer solution and allow it to stand for 5 minutes. Gently wash off the stain and allow the slide to dry. The slide is examined under the microscope. We go on to the next section, which is about staining. Staining is the process of impregnating a substance, especially a tissue, with pigments so that its components may be visible under a microscope. Contrast stain is a stain used to colour one part of a tissue or cell which will remain unaffected when another part is stained by another colour. A widely used method of staining tissues for microscopic examination is hematoxylin eosin stain. It stains the nuclei a deep blue-black and the cytoplasm pink. On page 49, we continue with the hematocrit. The hematocrit is among the most commonly used of all laboratory diagnostic procedures for the analysis of blood. The first phase of the procedure is the determination of ESR. In the second phase, the tube is centrifuged so that its contents separate into 3 layers. Packed red blood cells at the bottom, a reddish-grey layer of white blood cells and platelets in the middle, and plasma at the top. The depths of these layers are indicative of health or disease. The next section is about the determination of the erythrocyte sedimentation rate, in short ESR. The sedimentation rate is the rate at which the erythrocytes settle out in blood to which an anticoagulant has been added. The ESR test is a non-specific laboratory test of the speed at which erythrocytes settle out of unclotted blood. The blood is stored for at least 2 hours after it is obtained before proceeding to determine ESR at a fairly even room temperature. After careful mixing, the blood is placed in a long, narrow, calibrated tube, which is then placed in the test tube stand in a vertical position. After an hour, the ESR is measured. The ESR is the distance the red blood cells fall in an hour. Normally, it is less than 10 millimeters per hour in men and slightly higher in women. The speed at which the cells settle depends on how many red blood cells clump together. If acute phase proteins released during inflammation are present, clumping is increased. Therefore, the sedimentation rate indicates the presence of inflammation and is used to track the onset and progress of inflammatory disorders. An elevated ESR may be among the first signs of an otherwise hidden disease. And now we move on to the last section of this text, which is about blood gas analysis. Blood gas analysis is used to diagnose serious metabolic and respiratory disorders. It is chemical analysis of the pH, carbon dioxide and oxygen concentration and saturation of the blood. Arterial or venous blood may be used to perform the analysis, but only arterial blood is used when lung function is evaluated. The blood sample is usually collected in a herpenized syringe. The specimen should not be exposed to air and should be immediately placed on ice. And that ends the reading of our text. If you have any questions, if you're not sure about any of the new words, you can leave a comment or a question below the video in the comments section. So that's all for now, and bye-bye.